In tonight's Health Edge, eye-opening new numbers revealing huge changes in smoking and drug use among our high schoolers.
Some of the trends are promising and others pretty alarming. Chief Health Editor Dr. Partha Nandi joins us now with more on this one. Doctor.
Yeah, it's amazing stuff. You know, the biggest takeaway here is for the first time ever, get this, more high school seniors are smoking marijuana than cigarettes. But let's start with the good news first. Cigarettes reaching an all-time low, 5.5%. Alcohol use also continuing its long-term decline, now at 41%. Teens are drastically cutting back on the use of synthetic marijuana, also known as K2 or spice, down from 11.4 to 5.2%. And less are using prescription painkillers, down from 10.5% to 4.4. Heroin all-time low at 0.5%. So, you know, this is all good stuff, right? What about the bad news? Back to marijuana use. 6% of high school seniors are smoking pot. And this is what my patients are saying too. A lot of the patients are saying that marijuana, they're not even considering that a big deal anymore, which is really concerning. Recreational use of Adderall, you know, typically prescribed for ADHD, still high, 7.5% among seniors. So we got to really talk to them about this, that those drugs are actually real. Other tobacco products like hookah use at 19.8% and small cigars at 15.9%. So, you know, my recommendations, Partha's prescriptions, parents, teachers, you're really invaluable. Also, coaches and mentors, talk to the youth about making healthy decisions that will keep them on the path towards a successful future. And taking some of those drugs, including marijuana, will not be in that path. Also, addiction is a brain disease. This is important. It's not just a behavioral problem, but it's a brain disease. Identifying addiction early can better treat this disorder. So I think that's really important to have the good and the bad together. But parents, when you see signs of changed behavior in your teens, ask the questions, ask the tough questions. A lot of times my patients, you know, they don't want to ask their teens the tough questions. Please ask them, because guess what? When they're in their school, marijuana is often like nothing. So what I want to do is look for any changes in behavior, any changes in their activities, things that they find fun is not fun anymore. So if you do those and get them in the right path, that's really, really important. I'm Dr. Partha Nandi for Action News.
Important advice there, Doctor. Thank you.
Sure is, Doc. If you have a question or health concern for the good doctor, you can email him at drnandi@WXYZ.com. Send it to us, Facebook, Twitter, email. We'll get it to him.
And we're going to